How do we change from this to this within 7 days? Today we are seeing a new patient from Bintulu. This is a 2 years old. Is it 2 years old?
10 months.
10 months old, sorry. 10 months old. Wow, that's a big 10 months old baby suffering from eczema. You can see that the cheeks are very inflamed, and that's normally due to the saliva. The arms, the legs, they are very inflamed and flaky and itchy, and some of the part is actually wiggly. So we'll look at behind. Oh, you're following me. Okay. Yeah. Okay. And the back. Down here. Alright. So it's very, very, very bad, in bad condition. How itchy is he in 0 to 10 scale? 10. And how does the condition affect his sleep? 0 to 10?
I would say
8. That means he wakes up every few hours?
Yes.
To scratch?
Yes.
Okay, the scratch marks is very severe here. Hello, baby. That's good. Let's just, we're gonna see how we can help him. Explain to you, only one of the parents, So this is Cora. This is how we judge how severe the eczema is. So this one, look at him, is under 2 years old. We use this scale. On the face, behind, basically the whole body in his condition. Itchiness is 10, sleeplessness is 8. And let's count. 89.5. 89.5 is what we call severe eczema. Okay? So every time when you come for review, we will count this for you. Okay? Whether he's getting better or not, we have to invest on this value. So now, okay, 7 months old. Now he is only 10 months, only 3 months. 3 months, I can. Have you been to any doctors, dermatologists, GP?
We did been to do
skin specialist.
Yeah.
And then
and it's given that antibiotic cream. There's no name on the bekas dia ada nama.
Oh, jadi nama. Every time when you go to see a doctor or you go to buy medicines in any places or pharmacy, legally they cannot give you an empty things without any name and strength. Okay, this is your right to know and your right to ask. So you can call back to us what is the ingredient and how many percent it is. This is to ensure that, you know, with something like allergic things happen, you know what is allergic to, whether this treatment is useful or not. You know, maybe you went to another second opinion, or you go back to the doctor, or you went to another second opinion. We must know. It's shortened our journey if we know this one doesn't work already. We don't have to put it back and let you try for 1 week. It's a waste of time. Okay? You're wearing the cloth back. Okay. All right, mommy. Nice. So this one, do you understand what sort of eczema is this?
Severe.
There are 8 kinds, 7 to 8 type. Anyone explain to you about what sort of eczema is this?
no.
Did it start with scaly scalp?
Correct.
With yellowish crust on the scalp? This type is called seborrheic dermatitis. Seborrheic dermatitis. Okay, it's one kind of eczema. Okay, so this kind of seborrheic dermatitis normally affect kids a few months old, but normally it happens when they are 3 months old.
He started to have this, I think, 6 months. That is the first one.
Yeah. Okay. So this one characterized by yellow, thick skull, the like crust on the skull, and then they have rash here and there. But sometimes it will be worsened by the saliva. Then they start to produce saliva, they play with saliva, they get inflamed redness because in saliva there are enzymes that can make it worse. So when you see that he's playing with saliva, you have to wipe it off immediately with wet cloth. Nothing would, and if you use a dry cloth, it won't do anything. You must put a bit of water and wipe it off, okay? Because the dry cloth cannot wipe off the saliva. And these kids will feel better if they're staying in 16 to 22 degrees Celsius, very, very cold place. So in your room, make sure that you turn on the aircon until this. You understand? Otherwise they'll feel itchy. So especially they are sleeping, make it as cold as possible. So seborrheic dermatitis is not hard to treat. It's not hard to treat. It look for us, we have many cases of seborrheic dermatitis. Okay, this is one of the kids from Semenanjung. It's also but this is much worse than your kid. This one is a girl, 4 months old. See the crust? This is what we give it to her after 4 days. But a lot of scars because it's too severe already. This is after 4 days only. If you are responding, if the kid, the baby is responding in our management, 80% of the population will get 80% of improvement in 1 week. 10% no response at all. Not getting worse, not getting good. Okay? Yeah. 10% getting worse. Okay, that is because of the genetic difference to the treatment. Their response is really different, and what we eat, our environment, it all can contribute to the response. Okay, but never mind. We still proceed with the treatment, and I hope you can see you will be like this girl. But you look at your kids very, very bad when you compare to her. It's a bit milder. Okay, so don't worry. Okay, as long as you follow the treatment, the procedure. If she is within that 80%, you will be fine. Yeah, within a week. 7 days later.